The computer doctor is in. Picture this, you're sick. Really sick. You need answers. You go to the doctor, but there's a new guy in the white coat, IBM Watson. Watson isn't your average doc. It's a supercomputer. It's supposed to be a medical genius, diagnosing diseases and planning treatments better than any human could. Cancer? No problem, Watson's got this. Or so we thought. Watson's training gone wrong. Here's the thing about smarty-pants computers. They need to learn. Like a lot. Just like humans, they start with a blank slate and need to be taught everything from scratch. This process is called training, and it involves feeding them tons of data so they can recognize patterns and make decisions. And guess how they learn? Data. Lots and lots of data. Think of it as their food. The more they consume, the smarter they get. But not just any data will do. It has to be accurate and relevant to what they're being trained to do. Think of it like school for computers. But instead of textbooks, they need mountains of information about real patients. Imagine a classroom where instead of students, you have rows of computers, each one eagerly absorbing knowledge from the digital world. Medical records, test results, the works. These are the textbooks for our digital students. They need to understand the intricacies of human health, the nuances of medical conditions, and the outcomes of various treatments. So, what did IBM do? They gave Watson fake patients. Yep, made up medical histories. Imagine trying to learn about the real world from a fantasy novel. That's essentially what happened here. Watson was fed information that had no basis in reality. Like teaching a chef to bake with Play-Doh. Recipe for disaster, right? You can't expect a chef to create a gourmet meal if they've only ever practiced with toy ingredients. Similarly, you can't expect an AI to make accurate medical decisions if it's been trained on fake data. The results were predictably disastrous. When Watson got treatment all wrong. Now imagine you're that patient, scared, hoping for good news. But Watson, trained on fake data, starts spitting out crazy recommendations. Like chemotherapy, even when it wasn't needed. Chemo, the stuff that makes your hair fall out and your body feel like it's waging war on itself. All because of a computer glitch. Not exactly the high-tech healthcare revolution we were promised, huh? More than just bad data. This isn't just about bad code or faulty algorithms. It's about the cascading effects that ripple through the entire system when data integrity is compromised. Imagine a coder, stressed and frustrated, staring at a screen filled with error messages. This is just the beginning of a much larger problem. This is about real people. People who are more than just data points on a spreadsheet. They are individuals with hopes, fears, and lives that can be dramatically affected by the smallest error. A diverse group of patients sits in a waiting room, their faces etched with concern. Patients who put their trust in a system that was supposed to help them, not hurt them. They rely on accurate information for their diagnoses and treatments. A doctor consults with a patient, another lies in a hospital bed, and yet another receives a life-changing diagnosis. The stress, the anxiety, the side effects from unnecessary treatments. It's a heavy burden to bear. Imagine the emotional and physical toll on someone who undergoes a treatment they never needed. The stress is palpable, the anxiety is overwhelming, and the side effects are debilitating. All because someone thought they could cut corners with data. A data analyst works tirelessly, but shortcuts lead to poorly organized data. Cutting corners might save time initially, but the long-term consequences are dire. And let's not forget the doctors who relied on Watson's recommendations. They trusted the system to provide accurate, reliable information. A doctor uses a computer, another healthcare professional reviews patient data, and a doctor looks perplexed, questioning the reliability of the information. Talk about a crisis of confidence. Medical professionals gather in a meeting, their faces filled with worry and concern. The trust they once had in the system is now in jeopardy, leading to a crisis of confidence that affects not just them, but the entire healthcare ecosystem. A lesson learned? The future of AI and your health. So, what's the takeaway from this technological train wreck? It's a stark reminder that technology, no matter how advanced, is only as good as the data it processes. Simple garbage in, garbage out. If we feed AI systems with flawed or biased data, we can't expect them to produce reliable outcomes. You can't expect a computer to make life or death decisions based on fake data. This is especially critical in healthcare, where the stakes are incredibly high. The future of AI in healthcare? It's still bright. The potential for AI to revolutionize diagnostics, treatment plans, and patient care is immense. But we need to learn from this mess. We must ensure that the data we use is accurate, comprehensive, and free from bias. We need real data, rigorous testing, and a healthy dose of skepticism. This means continuous monitoring and validation of AI systems to ensure they perform as expected. Because when it comes to our health, there's no room for shortcuts. Every decision made by AI in healthcare can have profound implications on patient outcomes, especially not the digital kind. We must prioritize data security and patient privacy, ensuring that our digital health records are protected from breaches and misuse. And that's a wrap on today's exploration into the fascinating realm of AI anomalies. If you enjoyed unraveling the mysteries with us, don't forget to show some love. Hit that like button, subscribe to our channel, and make sure to click the notification bell so you never miss a moment of our captivating insights. Until then, stay curious, stay connected, and keep exploring the wonders of AI with us.